Great day. Now our lesson for microbiology is all about superficial and cutaneous mycosis. It's just a summary: subcutaneous mycosis, systemic and opportunistic mycosis. So what is mycology? So in mycology, fungi are the study of fungi, and fungi are eukaryotic organisms like your molds or filamentous fungi, which are composed of a mass of branching thread-like tubular filaments, otherwise called your hyphae, that elongate at their tips. And type of fungi, another type of fungus is the yeast, which are unicellular, usually is a round fungi. Or there can be dimorphic fungi that exist as molds or yeast depending on the temperature or other environmental factors. And take note, all fungi do not need sex because they can reproduce asexually. And though some also can enjoy to produce uh, by sexual means. So what are the types of fungal infections? Let's go to the meat. Okay. Commonly classified based on the site of the disease or the immune status of the host. And one type would be your superficial mycosis, which is the infects the outermost layer of the skin, the hairs, and the nails. The cutaneous mycosis, which affects the deeper layers of the hair, skin, and nails. The subcutaneous mycosis, which now affects the deeper layer, the dermis, okay, subcutaneous tissues, muscles, and even the fascia. And of course, the systemic mycosis, which often originate in the lungs but disseminate to the other organs, especially in immunocompromised individuals. And last would be your opportunistic mycosis, which are generally will occur only in patients with compromised immune systems, like those suffering from cancer or who are receiving immunosuppressive therapy, those suffering from human immunodeficiency virus, or even those that are exposed to for a long time to broad spectrum antibiotics. Okay, that could be uh, types of your opportunistic infection mycosis. So this is a nice table that differentiates the different fungal infections as to the infection, the etiologic agent, then what are your differentials or other conditions to exclude. Okay. So here would be your aspergillosis, which are caused by your Aspergillus species, your blastomycosis by Blastomyces dermatitidis, your candidiasis by your Candida albicans, your chromoblastomycosis, which are caused by your uh, dermatiaceous soil fungi, your coccidiomycosis caused by your Coccidioides imitis, your Cryptococcus coming from your the excreta of the birds, okay? Cryptococcus neoformans, your histoplasmosis caused by your Histoplasma capsulatum, your mycetoma or your eumycotic paracoccidiomycosis are caused by your dermatiaceous soil and your Paracoccidioides brasiliensis. Your ringworm or your tinea is caused by many species like your Trichopython, your Mycosporum, and your Epidemopython. Your sporotrichosis coming from, I think, as I remember it, coming from even the puncture from thorns of plants, your Sporotrix skenki, and your zygomycosis caused by your rhizopus and mucormycosis. So in here would be your difference that you have to exclude, okay? Whenever you will be entertaining or suspecting such histologic agent. your superficial and cutaneous mycosis, example would be your superficial mycosis, like your Theriasis versicolor, and your Theriasis nigra, which involve the outer layer of the skin. These are treated with keratin-removing agents or with topical miconazole. Even your white piedra and black piedra involve the hair shaft and treated by cutting the hair below the nodular lesions. For your cutaneous, so this is an example of your ringworm. Okay, it's caused by your trichophyton, your microsporum or epidermophyton. These are your dermatophytes. Okay. They contribute to seborrhea and dandruff. Or this one, as this is your ringworm. Okay, because it's a fungal infection. It's not a worm that burrows under your skin, but rather it is a type of fungal infection. As to affectation, it involves the scalp, especially in those involved in the formation of dandruff. That would be your tinea capitis. In your groin, okay, your jack itch would be your tinea cruris. Your athlete's foot, okay, in the feet, that would be your tinea pedis. Cutaneous mycosis of the nails or nail fungi, that would be your tinea unguium. So these fungi are identified and visualized by the use of your potassium hydroxide preparation of skin scrapings. So the treatment for such cutaneous mycosis would be for skin infection, you can give topical azole antifungals like your ketoconazole, your miconazole, or clotrimazole. Okay. For hair infection, you can use your ketoconazole or a sulfur-containing shampoos and your chrysofulvin. And for nails, you can use your azo antibiotics like topical or systemic, surgical, or chemical removal of the infected nail. Now for your subcutaneous, opportunistic, and systemic mycosis. For subcutaneous mycosis, it involves melanin-containing or dermaticeous fungi. Oh, I'm sorry for the tongue twist. Okay. These fungi are present in the soil or decaying vegetation, and the organism usually enter through cuts, through punctures, or stabs caused by contaminated thorns or sharp stools. So example, as I mentioned earlier, would be your Sprotrix skenki that causes your sprotrichosis, and it causes a chronic nodular and ulcerative nodular lymphocutaneous lesions along the lymphatics. As I say, it's your rose gardener's disease because the entry point would be through the contaminated thorns of roses. Your chromoblastomycosis is a dermaticeous soil fungi, like your verrucoid or warty nodules with cauliflower-like appearance, or your pseudoepitheliomatous hyperplasia. So these are your opportunistic mycosis. So we come forward now. So opportunistic, like your Candida albicans and other Candida species, they may cause systemic candidiasis. Your Cryptococcus neoformans causing cryptococcosis. Your Aspergillus formigatus, other Aspergillus species, causing aspergillosis, but may start with a lung condition. Your species of your Rhizopus, Obsidian mucor, and other zygomates can cause your mucormycosis or your zygomycosis. And the relative of your Penicillin marnifae, causing your penicillosis. Okay, so your systemic mycosis may occur in healthy individuals, and many systemic mycosis are asymptomatic or manifest as a relatively mild self-limited pulmonary infection. In the immunocompromised individuals, this systemic mycosis generally exhibit more serious lung involvement and often disseminate to other organs. So again, in contrast, okay, your healthy individuals, you may have many systemic mycosis, but they are usually will manifest as relatively mild and are self-limited. But it will have a different story. It now involves an immunocompromised individual because this systemic mycosis may exhibit more serious lung involvement and may often go systemic dissemination. Your example of which will be your Blastomyces dermatitidis. It will present like tuberculosis, like pneumonia with possible skin, bone, or prostate involvement. So that would be one of your differentials for your tuberculosis. Next would be your Coccidioides mitis. This one is acquired through inhaling arch spores in the dust. Primary coccidiomycosis, or otherwise called your San Joaquin Valley fever, will present as an acute self-limited flu-like illness with fever, cough, joint pains, and sometimes erythema nodosum, or otherwise noted as painful nodules of the shin. Your Cryptococcus neoformans these are your encapsulated yeast, which are visible in India ink when you prepare your cerebrospinal fluid. Okay? The distribution of your Cryptococcus neoformans is worldwide, commonly in pigeon droppings and nests. Okay? Your primary cryptococcosis is often discovered accidentally as a solitary pulmonary nodule that may mimic carcinoma. Rheumatoid meningitis is the most common form of systemic disease. Then your Histoplasma capsulatum is another systemic mycosis, which will be seen as a small budding yeast seen within the macrophages. Your Paracoccidoides brasiliensis, otherwise called described as Captain Will's morphology of yeast cells in tissues due to multiple budding, like a captain's wheel in the ship. Okay. Your paracoccidomycosis is marked by ulcerative lesions of the oral, nasal, and nasal mucosa. So that's it, folks. That's a summary. That's a fast lecture on regarding fungal infection from the superficial to the systemic and to the opportunistic type. So hopefully you got something, you learned something, and if you enjoyed my video, my lecture, please don't forget to subscribe, hit that bell and that thumbs icon, and so that you'll always be notified whenever I'll be posting new lectures in many areas in medicine and science. Thank you very much.